Welcome everyone, and thank you for joining us for our webinar today on careers in public health. My name is Suzanne Walker and I will be your host today. We're so glad that you can join us for this important webinar. So let's get started. So we've already started the introduction. After I finish speaking, I'm going to turn things over to Gus Birkhead, who's going to cover government public health careers. He is going to be followed by Karen, or Kay Perrin, who is going to talk about working in community health. And then Lisa Sullivan will follow up with careers in biostatistics. And Richard Skolnik will round things out with global health careers. So all of our presenters are not only going to be speaking about, occupations or careers in their areas, but they're going to speak to the background and expertise necessary, the workplace considerations, employment prospects, job outlooks and salaries, and there are going to be a few sample profiles intermingled throughout. After that, we'll again, like I said, get to questions and answers for everyone. So just one more thing about this webinar. This is really designed for students, instructors, and professionals who are interested in learning more about careers in public health. So I think this will have something for everyone, and hopefully you will enjoy it. So rather than go into great detail introducing our presenters, I've asked each of them in their presentation to provide you a bit of their experience or CV from what their career trajectory and so what they've been teaching, what they've been doing throughout their career. And I think that will provide some good insight to their level of experience and also credibility to what they're presenting today. The other reason I really asked these four people to join us today is that they're all very knowledgeable. Each of them has a book with us, and within their books, they've all included at least a chapter, if not more, on careers in their area. So in the far left, Gus's book, Essentials of Public Health, includes several chapters on careers in public health, from government public health, which he's going to be talking about today, to occupational environmental health, to public health nursing, to epidemiology statistics, health promotion, and more. Kay Perrin has a brand new book on working in community health. It's literally hot off the press. And this is a great book for anyone considering working in community health, because she really explains what community health workers do, but then also provides a foundation for working in various community health roles. Lisa Sullivan's book, Essentials of Biostatistics and Public Health, 4th edition, just came out in a new edition last summer. And in that new edition, one of the key updates that she made was adding a full chapter on careers in biostatistics. And finally, Richard's book, Global Health 101, on the far right of the screen, has 2 important chapters covering careers, the second of which looks at 24 profiles of key global health actors. So as you can see, our presenters today really understand and know the importance of not only teaching about their area, but inspiring students and future professionals about the different career opportunities that there might be out there. And with that, I'm going to stop talking and I am going to turn things over to our first presenter, Dr. Guthrie Birkhead, or Gus, who's going to talk to us today about government public health careers. Gus?
Thanks very much, Suzanne. It's a pleasure to be here and look forward to the discussion after the presentations. Let me tell you a little bit about myself. I started out my professional life going to medical school and becoming a medical doctor, and I then went on in clinical work and became board certified in internal medicine. But somewhere along the way, I got this feeling that the patients I was seeing had diseases that could have been prevented if somebody had done something earlier. And so I made a shift. I actually worked overseas for a year in a refugee camp and then came back to the US and got a Master of Public Health degree and changed my course completely. So I'm no longer involved in providing clinical care after that point. I'd be dangerous in a clinical setting at this point. So immediately after my MPH, I took a position with the Epidemic Intelligence Service, the disease detective group at the Centers for Disease Control, For 2 years, I was actually assigned to the Vermont State Health Department, so that was a great assignment. I'm from the Northeast and like to ski, so that was perfect. But I also got a lot of great experience there. And then I did spend 1 year in Atlanta at CDC completing my preventive medicine residency, so I'm also board certified in preventive medicine. But at that point, I had to make a decision about whether I wanted to stay at CDC, which is certainly a governmental public health agency, as people are aware. At CDC, though, you become fairly narrowly focused on a particular area. It's a very large organization. And I felt I wanted to be more of a generalist. And so I took a position, looked around and took a position at the New York State Department of Health, where over the next 27 years, I had various positions. I started out in communicable diseases and the immunization program. For a while, I was the state AIDS program director and eventually became the deputy commissioner for all the public health programs, which included the infectious disease, chronic disease, environmental health, emergency preparedness, and the public health laboratory. I retired there in 2015, but remain on the faculty at the University of Albany School of Public Health, which is kind of a unique partnership between the health department and the university. And I'm also on a variety of boards and other things. And I had time to write a textbook or two. There you go. This is the Essentials of Public Health that Suzanne mentioned. It's one of the books. Actually, there's a second book which is similar content, but if you're interested in the career chapters, those chapters are in this version of the book, The Essentials of Public Health. And so if we switch to the next slide, let me just say a little bit about the role of government in public health and the public health infrastructure. I think the Institute of Medicine has issued over the years a number of reports on public health, and focusing on the broad public health system. Public health really requires the engagement of all segments of society that you see around the outside of this circle in order to be successful. And at the core of it, though, and hopefully sort of organizing the effort, is the governmental public health, the state health departments in local areas, the local health departments. We don't really have a Ministry of Health at the federal level, but the Centers for Disease Control serves as the public health agency at that level. So I think my point with this slide is, and in fact, the Institute of Medicine talks about the local health director as being the chief strategist for health. And so it's the government public health departments serve as a coordinating function around all segments of society if things are working as they should. But you see in these circles also that there are many different content areas, many different kinds of professions and information, educational background needed, and that applies to the government, the public health departments themselves. And so the next slide, the background, we were asked to talk a little bit about the background and expertise necessary, and that really varies widely with what it is you're going to be doing in the health department. So if you are a physician or have a PhD or a nurse or a lawyer, a professional engineer, that's what PE stands for, or a health education specialist or other area, that degree becomes sort of your professional entree into working at a state or local health department. But I think there's the Master of Public Health degree is sort of the degree that's most often used. And so if you're in any of those positions, physician, et cetera, to have an MPH, I think, gets you thinking like a public health person. And I think it may be required for some positions. In fact, some positions, there's now a certification in public health for people with MPH as an exam that you can take to become certified. Some positions may require that, not all at this point. But I think in whatever your background, to get a job at a state or local health department, a Master of Public Health is going to be a real plus. And then I'll talk more about this later, but depending on your state and local area, there may be civil service, a civil service system, and some positions may require an exam to be taken to qualify for certain titles in state and local government. That's not true for physician and other professional degrees, but it may be true for some. And so if you look at how the workforce breaks out, in governmental public health agencies, you'll see people with all kinds of backgrounds. A small proportion will have doctoral level degrees. Many will have masters, often masters of public health, bachelor's degrees, associate's degrees, and some with no college education. So at this point, only 14% have necessarily formal public health training, despite the fact that it's growing. So again, the MPH will be a great advantage if you want to get a job in this sector, regardless of what your subject area expertise is. So moving on to the next slide, just talking a little bit about workforce considerations. This is a breakdown by racial and ethnic groups of, I believe, state and local health departments. And I think you will find that state and local health departments probably are more diverse than some workplaces. And there's certainly been an effort in public health to increase the diversity of its workforce so it matches the diversity of the population that local and state health departments are trying to serve. It's still not where it needs to be, but there is certainly a diversity in the workforce that is intentional and is trying to be increased. So that may be a factor that you want to think about in thinking about future careers. So some other workforce considerations for working at a state or local health department. Likely you will be working as part of an interdisciplinary team. I mentioned that health departments are many different professions involved. I used to joke, and it wasn't really a joke, it was true, that there were more lawyers working at the New York State Health Department than there were doctors or nurses. So that's just the way it is. It is a large organization, a bureaucracy, if you will, for both the good and the bad connotations of that word. And so lots of different people need to be there. And so you will work with a wide variety of people. There is, obviously during the pandemic, a lot of the work was remote. I think many health department workplaces still are allowing some remote work, although there's a move obviously back towards having people in the office. I think the pandemic changed the view that you had to be in the office 40 hours a week or whatever. So that there is still some remote work allowed. Some travel may be required, particularly if there's a public health problem in a particular area of the state. You're going to want to go there and see what's going on for yourself. There are career tracks built in, especially if there's a civil service type system in the particular state or local area where you're going. So there is a chance for advancement. In leadership positions, you will be expected to be able to do public speaking and talking with the press. And I think ultimately public health is political in nature, small p political, and you will likely be, working under political leadership. You may be in an appointed position when you reach a certain level in the hierarchy. So you're working for a governor or other elected official, and you may be asked to follow policies that you may not completely agree with. So it's helpful to realize that going in and to know your limits and when you've reached them. So those are just some of the workplace considerations. In terms of prospects, now for better or for worse, there's a lot of positions available probably in state and local health department. There's been a lot of turnover related to the pandemic, but also the workforce was aging even before the pandemic, and so there have been a lot of retirements. There's also been a huge increase in federal funding. Federal funding tends to follow a roller coaster, so that may not stay up there forever, but at least right now, there should be positions available, and there's an emphasis from the federal level about providing funding for workforce at the state and local level. So that's good news. Salaries are going to end up obviously being position specific. You probably will not be able to get the salaries that you might draw in a public sector, but you may have some other benefits. For example, some state and local governments still offer pension plans and other things. Those may be less than in the past, but so that there are pros and cons. You can certainly make a decent living working in a state and local health department. But if you want to make a lot of money, that may not be where you want to end up. And just on the right-hand side here, just from survey data, a large proportion of the workforce is still planning to retire in the next few years or leave for other reasons. So I think there will be positions available, entry and mid-level positions available in many, many parts of the country. And I think we're approaching the end here just in terms of how to go about this. If you're interested in a federal job at CDC or one of those other agencies, you'll need to go through the USA Jobs website to look for jobs and apply through that. That's not really another way to do that. For state and local health department jobs, again, check their websites. And in New York and probably other states, there's a single unified hiring site for all state jobs. So take a look at that. Some health, I didn't put that on the slide here, but some health departments have private foundation arms attached to them, which also may hire people who work in the health department. So be aware of the situation in the local or state area where you're interested in applying. And again, I'll just mention that some places have civil service departments, and so there may be examinations given. And a good strategy, if you're in sort of that, not for the professional categories, but other categories, is to take as many civil service tests as you're able, and then you will be potentially solicited for jobs as they become available in the future. So that's a little advice on how to proceed with that. And then I think if we go to the next slide, I'm going to finish and look forward to your questions, and I'm going to turn it over to Kate Perrin to talk about community health workers.
Thank you, Suzanne, for organizing this for us and for the brief introduction. My name is Kate Perrin, and I had sort of a very distinct two roles in my career. The first 17 years, I was a community health nurse, and before that, for the students in the audience, as an undergrad, I worked as a certified nursing assistant in nursing homes. And so I got my feet wet in the career of nursing very, very early. And the community health nurse side of my career involved the health department. I also worked in a public health or a public hospital. FQHC stands for Federally Qualified Healthcare Centers and Clinics, and they focus mostly on inner city and migrant health, but you could also work in Indian Health Service, and we'll talk more about that later. I was a case manager for pregnant teenagers for a few years, and most recently, after retiring from the University of South Florida, I decided I wanted to go back to my roots as being a case manager, and so I worked as a geriatric nurse case manager recently. So people ask me, you know, how did you decide to get out of nursing and go into public health? Well, I don't really have a career path. I wanted to be a nurse. I became a nurse. And one day my supervisor at Tampa General Hospital said, we should go get our MPH. And I was like most people, what is an MPH? And I want to be a nurse, and I don't know why I need it. And she said, well, first of all, Tampa General is going to pay the tuition. And I said, okay, I'm in. And so that led me to a whole nother career, which lasted 26 years. I got my MPH, and then I went on and got my PhD. And I advised and taught undergrad courses, many undergrad courses, many graduate and doctoral level courses, and it was just amazing. Probably the high point of my career. I was chosen to be a Fulbright scholar, and I was able to teach and live in India for 6 months. So that was amazing. Some of the courses I taught, survey of human disease, my concentrations were in health ed and maternal and child health. And so those are some of the courses that I taught. And then later in my career, I advanced to being the assistant dean for the undergrad program and the associate dean later on for the entire college. So you don't have to just say, okay, well, I became a nurse and that's what I'm going to be the rest of my career. Just be open to other things that may come your way. And I always told the undergrad students, when you come to a fork in the road, take it. It's not a right or wrong. Just explore your options. You're not pigeonholed into what you majored in college, much like Dr. Birkhead said, you know, he was a physician and then he went on to a different part of medicine. And I think all of us talking will give some of those examples ourselves that happened in our own careers. So next slide, please. When we think about community healthcare workers and you go on Google or anything else and you put in jobs for community healthcare workers, you may not see any. And so this is a very important slide that is also in the book that I wrote, is that they have many names. It depends on the state you're in, the community, if you're going to be in the city or a rural area. So I just listed some of the ones that would qualify under community healthcare workers. So bilingual, anybody who's bilingual will do well in a career in community health workers. To do family outreach, team management, community care worker, advocate, outreach coordinator, case management. You see, it is a broad field, and COVID used a lot of community healthcare workers to be the contact tracers for specific diseases. So make sure that when you're looking on LinkedIn or Indeed or the website of health departments, that you just don't limit yourself to community healthcare worker, because that term is more popular in the Southwest, but in the Northeast and Southeast, it is not. It's one of the other names on that list, plus many, many more. Next slide, please. So if you're thinking that, wow, I think that community healthcare worker sounds pretty good. So here's some of the things that would help you to decide if this is what you want to do. A desire to help individuals and families in your community. So of course, yes, nurses do that, and physicians do that, and social workers do that. But if you're looking at an entry-level position with an undergrad degree or even an associate degree, this would be the list that you would be looking for. Do you like advocating for other people? You may be on some community board or something where you do advocacy for whatever. If you have experience in that and you like helping that and helping to move the needle forward for better housing or food or education, this would be a good career path for you. Learn about the community resources so that any person who asks you while you're working would, want to know where can I get my electric bill paid? I'm running out of money. Or how can I get my rent paid? And you need those kinds of resources, because people coming to rural health community clinics, inner city clinics, health department clinics, they are in need of more services than just healthcare. Another great thing about being a community healthcare worker is you get to be a team member of the healthcare setting that you're working in. And you are going to be the liaison between the family, the patient, and the healthcare team. Mostly, but not always, you might be the translator, and that is a very, very important role to make sure that the family and the patient is understanding. And maybe most importantly, that the physician and nurses are also understanding what the patient is asking or the family is asking. Workplace considerations. This is another thing that I would also talk to the undergrads about when choosing a career in public health. Do you want to work indoors or outdoors. That makes a big difference. I happen to live in Florida. If you don't like being outdoors in humidity in July through, well, actually May through October, then outdoor work in Florida might not be your best choice. But a community healthcare worker works indoors and outdoors. They may do a family visit, they may go out to a migrant camp, but primarily they're going to be indoors in a clinic setting. You need reliable transportation available daily. When I was a nurse for the pregnant teenagers, that was way before GPS, and the directions we would get were very, very confusing in rural Florida. It'd be the third blue trailer on the left, you take a left turn, and then you go 4 more trailers, and you take a right turn. And so reliable transportation was absolutely essential. You need to have comfort in talking to not only the clients and their families and the healthcare worker, but you may be also explaining to a resource that you're sending this family over, and this is what they need. And in some cases, the community healthcare worker would go with the client to that resource center because of the language barrier. In Florida, we have a large population of Central American people, so you may be speaking, you know, if you have the skills, you'd be very valuable for the language of Maya Indians and a whole variety of other languages besides just Spanish. And you must be comfortable with public speaking. If you're not comfortable in the beginning, after you have been a healthcare worker for a while, you'll be comfortable in public speaking because you'll be asked to do it so often. There are leadership opportunities and a career ladder, of which I'll talk about in the next slide or two. So federally qualified healthcare positions are always available, and the minimum requirements for that would be bilingual, verbal and written, and able to decide the health literacy level of what people need. You can have people that are knowledgeable in one area, but they don't understand medical knowledge. And sometimes that experience could be someone who is, and I've had a client like this, the son was going to be the caregiver for his mom, and he was a chemical engineer, and he knew nothing about his mother's medical condition. So health literacy is very, very important for community healthcare workers to know where the patient is and where you need to set the level of understanding, not only giving it as an example to the nurse and the physician, but also to the family, so we're all on the same level of health literacy. Experience talking to families, again, health literacy falls into that. And to be a community healthcare worker, you're going to have computer literacy yourself and how to explain to people how to use maybe a tablet to check in at the clinic, or just to find resources and help people fill out resource pages in order to get the funding or the needs that they have to have met. So desired qualifications is some knowledge of medical terminology. It does not have to be extensive, but you do need to have a basic knowledge of, I would say, at least the top 10 disease processes, and that's easy to find. Knowledge of healthcare, you need to know the difference between Indian Health Service, Medicare, Medicaid, both Medicare and Medicaid, TRICARE, which is the veteran healthcare system. So learning all of that would help a lot when you're working in community healthcare workers. And most, well, not most, a large percentage of community healthcare workers also work with elderly. They are not doing home health care. Do not think that community health care workers are home health aides. They're not. They're a level above that. There might be hiring home health aides for elderly, but you have to have at least some knowledge of that. And again, the community resource centers. Next slide. So the job outlook for community healthcare workers are excellent at this time, especially after COVID, because so many people in the healthcare system decided, you know, I'm done with this, and we always need those health advocates in the community. The starting salaries range from about $36,000 to $59,000, and that's from U.S. News and World Report of 2021. And the mean income, at least in the Southwest, is about $46,000. And you get leadership opportunities. You may be the first community healthcare worker in a clinic, and after a few years, they decide that they're going to hire another one. You're going to be the supervisor for that next one. So there is promotion and salary increases as you go through your career. And the last slide is an example of community healthcare workers that I've actually interviewed. And so Belinda, 34 years old, worked at the health department clinic in downtown Denver. She moved to this low-income neighborhood 10 years ago to care for her grandmother. She became a CNA, certified nursing assistant, after high school, and her extended family paid her to live and care for her grandmother for the next 6 years. After her grandmother passed, she applied for a community health care worker position. She knows the clinic that her grandmother went to. She knew all the community resources for the elderly, and she knew many of the seniors in the neighborhood. Her daily duties included meeting with seniors and their family after an appointment to explain the treatment plan, the medication changes, how to make follow-up appointments for the family, and mostly to chat with them about their health in a suitable and of course the right language to understand. Each month she visited faith-based communities to host healthcare seminars, check in with local pharmacies for vaccine updates, visit community resources to make sure that they stayed current, and to stay in contact with the seniors. So that gives you kind of maybe a overview of a snapshot of what a community healthcare worker would be doing. And now I will hand the microphone, literally, virtually microphone, off to Dr. Lisa Sullivan, and she's going to talk about careers in biostatistics. Thanks.
Thank you, Kay. So glad to be here with all of you. My name is Lisa Sullivan. I'll tell you a little bit about how I got to where I am today, which is a faculty member at the Boston University School of Public Health. I've been here for 26 years. As an undergraduate, I was a math major, and I know, unlike many of our current students, I really had no idea what I wanted to do. I liked math, and so I thought I wanted to be a math teacher, but at the time I was in college, which was a long time ago, there really were no opportunities for math teachers. And that's a little different than today, but I got talked out of the math education major, and I just did straight math. I liked math, so I did it, but I honestly, when I graduated, much to my parents' dismay, I really had no plan. But I graduated with an undergraduate degree in math. And I then went to graduate school in statistics. And the reason I gravitated to statistics, again, not really knowing where I was headed, but I liked the one course I took as an undergraduate in statistics because of the applied nature of statistics. I liked using math to solve problems. And I particularly liked focusing on health problems. I felt like that was a good application for me to put together my math skills and my interest in solving important problems. So I gravitated towards biostatistics and did my graduate work in biostatistics, and that's what got me to where I am today. So today I do three things. I am engaged in teaching, in research, and administration. My teaching includes courses in biostatistics, and It's wonderful if students come into those classes excited to learn about biostatistics, but that's not always the case. Often they come into those courses because they are required to take biostatistics for something else that they're passionate about. But that's okay, because I think it's great to work with people who are passionate about other things, and I can hopefully help them to hone their biostatistical skills to solve those problems that they care about. I also teach courses, Quantitative Methods for Public Health. This is one of our courses in our Masters of Public Health. And then, of course, Communication and Collaboration for Public Health Leaders. I've had the great privilege to work on some important research studies, one of which is the Framingham Heart Study, which maybe you've heard about. It's the longest running epidemiologic study for risk factors for heart disease. And it's run out of Framingham, Massachusetts, which is about 20 miles west of where our campus sits. And I worked on a small piece of it. It's a huge study with lots of people involved. And I worked on a small piece to develop what are called risk prediction models. These are mathematical equations that, based on a person's set of risk factors, their age, their sex, their blood pressure, and things like that, you can predict the likelihood that they might go on to develop heart disease. And if their risk is sufficiently high, you might be able to intervene. I then worked on another study looking at the association between alcohol exposure and pregnancy and sudden infant death syndrome. This is a really important study because sudden infant death syndrome is the death of a child before a year of age, which is absolutely devastating to everyone involved in the situation. And this was a study to try to determine if there was a link between alcohol exposure and pregnancy and SIDS. And then a clinical trial to look at drug therapy for children with autism. And you might say, I don't see the link with all of those studies. And you're absolutely right. And that's why I selected them, because these are very different studies. And this is what biostatisticians do. You work on different studies. Hopefully you bring something to the table, but you work with other members of the team who have expertise in cardiovascular disease, in infant, issues that affect infants, in issues that affect children with autism, and you learn from those experiences. So that's what I like about biostatistics so much. And right now I have an administrative role. I oversee our educational programs here at the School of Public Health at Boston University, and one of those offices is our Career Services Office, which is related to what we're going to talk about today. And I also have the great opportunity to be the chair right now of the Association for Schools and Programs of Public Health Steering Committee that's looking at envisioning our future education system for public health. So it's an effort that involves lots of people thinking about where we might go in public health. So it's an exciting opportunity for me. Next. So if you're interested in biostatistics, what you really need is an interest and an aptitude in math. And there's also a fair amount of computing. Now, some people mistakenly think that biostatisticians sit at the computer all day and just look at the keyboard and at the screen. That's actually not what we do. That's a small part of what we do. I happen to think that's a fun part, but it's not all we do. It's also very helpful if you have some knowledge of biology, life science, or health science. I never took courses in any of these areas, so I needed to pick up a lot of that along the way, through work and opportunities with multidisciplinary teams. If you like solving problems, biostatistics is for you. It's extremely important that you have good communication and collaboration skills, because we tend to work alongside other people, and it's really important to be able to communicate effectively. And of course, there's a need for attention to detail. And again, all of these things are nice to have, good to have, but you can develop them through courses or on the job. Next. The kinds of positions that people with training in biostatistics go into vary by the degree. There are lots of opportunities for people who have a bachelor's degree, and this might be a bachelor's degree in statistics, biostatistics, data science, or other quantitative field. Your school may not offer biostatistics, but it has something related, and that will prepare you well for positions as a research assistant, a data analyst, or a statistical programmer. There are also lots of opportunities at the master's level to be a biostatistician, a data analyst, a statistical analyst, data scientist, clinical research specialist. These are just some examples of the titles that people take. And then certainly at the doctoral level, you can work in an academic institution or a research institution as a research scientist, a biostatistician, a health data analyst, or a data scientist. Next. Now, in terms of getting into higher level, I left bachelor's degree, you can do that at the undergraduate level. If you're interested in a master's degree, many of the Master of Arts or Master of Science programs in biostatistics require that you have some training at the bachelor's level in a quantitative area. That might be a math major, a statistics major, something like that. If you don't have those, they will often look for some exposure to calculus and a course in linear algebra. Now, you can also do training in an MPH. Many MPH programs don't have these requirements. Our school, for example, has no undergraduate requirement. You have to have an undergraduate degree, but it doesn't matter which one. But if you're interested in the MPH but want to specialize in biostatistics, you can do that without a strong focus at the undergraduate level. And then doctoral level training in biostatistics requires some master's level training. Again, if it's not in statistics or biostatistics, you can fill those gaps. And there are lots of funding opportunities for students interested in doctoral training through training grants and research assistantships. Next. Biostatisticians work on a lot of different kinds of problems. And this is what I think is so exciting about the field, is you bring some skills to the table, but you can work on many impactful questions that affect people's health and well-being. And you work collaboratively with people from other areas to solve problems. We certainly have ethical principles that we have to abide by. We have to, do our work with integrity and accountability, and always respect research participants. And I will say another exciting thing about the field is we're always learning. There are always new statistical applications, but there are always problems that we can learn about and hopefully be part of their solutions. Next. The job outlook for biostatistics is very, very good. There are currently around 37,000 biostatisticians in the United States, and the market is expected to grow by 33% through the next 5 years or so. So this is a tremendous opportunity for anyone interested in joining the field. Next. The job prospects for statisticians, mathematicians, and statisticians are extremely strong. The outlook for all occupations considered, the growth over the period 2020 to 2030 averages 5%, but for statisticians, mathematicians, and statisticians, it's up over 30%. So it's a very promising field, and there are certainly lots of opportunities for people with training in these areas. Next. The people who work in this field, I think, generally are very satisfied because there are lots of opportunities. It's a very competitive salary. The salaries vary. I didn't put any numbers here because they vary widely by industry and also by the degree level and your level of experience. The collaborative work, I think, is fun. It's fun to work with people. It's rewarding to work on important problems and to make a difference, and it's intellectually challenging work. Next. Just an example profile. Again, this is just to illustrate the fact that what biostatisticians do not do is just do statistical analysis or work at the computer all day. That's a piece of it. That's one of the bullets, but it's not the biggest piece. What we do is work with others to understand the extent of a particular issue, who's impacted and why, think about potential causes, think about how we might study that particular issue. We collect, organize, and manage data. We do the statistical analysis, but again, one bullet of many. We interpret results and then communicate findings. So there's a lot to this field if you're interested. Next. It's now my pleasure to turn things over to Richard Skolnik, and he's going to talk about careers in global health.
Thank you very much, Lisa, and thank you very much, Suzanne, for inviting me today and allowing me to join a panel of such talented people. I also hope, as has happened with previous webinars, to hear from and learn from those who have joined us today. I'm going to make a very brief comments about each of the slides while you read the slides, kind of principled comments. About my career, I only want to say 3 things. One is my career has been remarkably linear, which is unlikely to be the case for many young professionals coming along today, because unlike Dr. Birkhead and myself, people today tend not to work 25, 26, or 27 years, or the same for actually all of us in one place. 2 is much of the work that I did professionally didn't exist when I was a student. HIV didn't exist. The quest for universal health care coverage in low-income countries didn't exist. And vaccines for a range of vaccine preventable conditions like pneumococcus, HPV also didn't exist. And this phenomenon is likely to be the case for today's students as well. And it suggests that we need to be encouraging our students seriously to think about mastering frameworks, concepts, skills, principles, and understandings rather than believing, as so many of them do, that they really need to learn all about everything. They need to master frameworks because, just like for me, most of what they work on won't exist when they're a student. And thirdly, I've happily moved seamlessly from being a global health practitioner to being a global health practitioner and educator at the same time, to being a global health educator, community global health activist, and grandfather all at the same time. And I wish that everyone had the same seamlessness as they moved along their career as I have. Next slide, please. Duke University's website says that global health is fundamentally about achieving better health outcomes for vulnerable populations and communities around the world. Those who study or practice global health work to eliminate health disparities in low resource settings around the world through research, education, and collaborative intervention. So for our purposes, what's really important is to understand that the health of people, especially marginalized people in low and middle income countries, remains an important focus of global health efforts. However, global health includes much, much more, including these areas that I mentioned here, including pandemic preparedness, addressing complex humanitarian emergencies, and sharing ideas about making health systems more effective, more efficient, and fair. Next slide, please. Global health, like public health, is an enormously diverse field. It has many more actors than we can count. So I always encourage my students and career seekers to categorize the actors from the beginning of their global health studies, or they're going to get completely lost. Of course, one can work, as Dr. Birkhead and others have suggested, for your own government, whether you're in Rwanda, you're in the United States, you're in Australia, or you're in the state of New Mexico. But one can also work in a range of different kinds of organizations, as shown both here, and if you would go to the next slide, Suzanne. And in the next, and then in the next slide. Why don't you, and this is okay as well. So there are also a range of broad types of work in global health. And in this sense, they're not really different from what the other speakers have said so well about public health more generally. I always encourage students and young professionals to develop a broad understanding of the field, to try out several of these areas while they're studying, and then to get a sense of what might be the best fit for them. As one helps students to think about this, one generally has to help them get a better understanding of what does it mean to engage in research in global health? What is policy work on global health? What do the advocates do, et cetera? But I think it's really important for them to get an understanding of these various types of work. Hopefully through the experiences we'll talk about, try some on. And then as they develop both in their studies and in their career, to find what area, I repeat, fits best for them. Let's go to the next slide, please, Suzanne. There's also an extraordinary array of functional areas, generally not that different from public health more broadly. But there's a wide array of functional areas in global health. Generally, as I mentioned, they're similar to those in public health. Some, however, different at least in magnitude from what you would be doing if you were working on, say, domestic United States public health issues. This especially would be the case, for example, for work on a range of health systems issues, as well as global health having a special concern for issues that continue to affect the poorest countries, such as undernutrition, communicable diseases, and the need for essential surgery. What I like to suggest to my students and young professionals is they have a game plan for thinking about where they might want to go and how it is they're going to get there. I always begin my advising sessions by saying you don't have to know where you want to go, but tell me what you think you want to do 15 years from now and the platform from which you think you might want to be doing it. And then let's talk about the knowledge, the skills, the experience, and the behaviors that you're going to need to get where you want to go. And it's because so few of my students understood either of these points, and there was so little coherent information available about careers in global health that I added the 2 chapters to my book, as Suzanne mentioned, one on working in global health to help students think about frameworks for considering careers in global health, and the others, profiles of 24 global health actors, since I believe, as I'm sure my colleagues do, it's extraordinarily important, which most students and young professionals don't understand, that you have role models, that you think about people you might want to be like as your career develops. Next one, Suzanne. There are a range of core competencies in global health. They're not different in many respects from the core competencies my colleagues have mentioned so well. However, to work on global health, one has to develop competencies in places, languages, and cultures beyond those that you would have to do domestically. To work in the United States, you have to be culturally competent across a wide range of cultures and domains. But to work in global health, you have to be competent in an even wider range of places, cultures, and languages. The next one, Suzanne. Look, to be a nurse, you got to go to nursing school. To be a physician, you got to go to medical school. To be a global health actor, you have to become a global health person. And these are some of the ways that you do that. I want to make one very, very, very important comment about internships and work study. I think there's an enormous amount of misunderstanding about internships and work study in global health. And to tell you the truth, in many respects, it's exactly the same if you work in domestic health. Once you leave your own community, the same issues arise. I want to suggest that we have to remind our students they should not avoid internships and work study because they're concerned that they can't contribute, that they can't change the world, or that they'll be colonial in what they're doing. What they must engage in such activities, but they need to engage in activities like this that are ethical, that are based on allyship and partnership, and that they are based on the idea that these are wonderful learning opportunities for them that should be treasured. You cannot become an actor in global health without this. Suzanne, just 2 quick last ones, if I might. Go ahead. Just as Dr. Birkhead, Lisa, and Kay have all said, the field is a wide one. You can go to the next one, Suzanne, if you would. It's a very, very wide one. And it's extraordinarily important for us to remind our students, young professionals, and ourselves that almost anyone in almost any field can work in and make valuable contributions in global health. You can be a scientist, an engineer, a journalist, etc. There are possibilities. One of my favorite global health colleagues is a person named Ellen Ogden. She is a saint of public health and global health work. I adore Ellen, as does everyone who meets her. She isn't a physician. She is an MPH. She has coordinated the USAID work on polio for now probably 15 or 16 years. She is a model I would want all students to read about, and that's why she's profiled in my book. The last comment I'll make on the last slide is, I had the great advantage of teaching at schools that had wonderful students. At some schools, the students are almost led to believe by career advisors that if they put their SAT scores on their resume, that's all they have to do. I want to assure you and encourage you to tell your students, no one cares in global health how smart they are. There's a million smart people. There's a million smart graduates coming out who could become important actors in public and global health. What matters is that you possess not only necessary technical skills, but also that you understand the humility, the cultural humility, the cultural competence and the behaviors. And I'll end by saying, one of my family members is a 5-boarded physician at a world famous medical center. When he went for interviews, which lasted 2 days, and I think there were 18 of them, nobody said to him, how do you manage sepsis, doctor? How do you do this? They had only one issue in mind, the extent to which he would fit in with their team-based approach and reveal some of the competencies that we see here. So thank you very much again. If any of you who are participating have questions, please don't hesitate to get in touch with me. I'm always happy to do what I can to help students, young professionals, and share ideas with other colleagues. Thank you very much again. And Suzanne, we'll go back to you.
Thank you, Richard, and thank you to all our presenters. I'm going to try to open up to a couple questions. I know we're getting close to 2 o'clock, so I'll ask the first one, and it's not directed at any one person, but if any of you presenters want to step forward and answer this, I think it's from a student or someone looking to pursue a career. I am interested in the One Health approach, specifically zoonotic disease. Can I pursue this career as an MPH, as an anthropology BA, question mark? Can anyone speak to that?
Well, maybe I could talk a little bit. One Health is the concept that animal health, people's health, and environmental health are all linked together. And it's a very multidisciplinary field. You can be a veterinarian, you could be a doctor, you could be a public health person. So I think, yes, an MPH is adequate to get you in the door in a One Health related activity. But as long as you have all the other characteristics of continuing to learn and to be able to work function as a team, I think that's fine.
Okay. We have another question here. Do you have any general advice for non-clinical MPH candidates who are soon to graduate? What can we do now to be competitive in the field of epidemiology?
So I'll just jump in quickly and say, I think get yourself an internship where you're doing some epidemiology in a practice setting at your local health department, your county health department. Try to find some place where you can work in the environment with epidemiologists as part of your MPH program. I think that more than any single course you could take or anything else would position you well to apply for jobs in epidemiology as an MPH.
Okay. Let me see. I'm just trying to scroll through some of these questions, see if we can get maybe one or two more. If the statistical software used in coursework is somehow irrelevant with popular ones used in DA, DS, Physician R, SQL, Python, what can we do to improve our background? I'm not sure if I read that right, but maybe Lisa can speak to this.
Sure. Different schools use different statistical software to illustrate statistical computing techniques, and sometimes it's whatever's available at the university. But don't worry if you don't have practice with something that is required on the job. If you've seen the applications of statistical software, you will pick up other tools, and so you can get experience and practice on the job. There are also many online free resources to learn about different statistical computing techniques. So I would take advantage of those as well, just to familiarize yourself. But don't not apply for something because you see they're using a particular software. You will be able to pick it up if you've had exposure to something else.
Okay, there's another question for you, Lisa. What would be an entry-level biostats work for MPH graduates who did not concentrate in this particular field? I have an associate's in biology and a bachelor's degree in psychology and currently working on my MPH with a concentration in community and public health practice. So any questions there?
There are many opportunities there. I would try to get a position as a research assistant on a project because you'll get exposure where you can build on all the skills that you have and you can develop the the biostatistical skills, the more quantitative skills along the way.
I am currently looking for an internship or job opportunities to solidify my specific interest in global/public health. I found that it's really hard to find opportunities that don't require an MPH, but I want some experience before continuing my education. Do you have any specific suggestions or advice on finding jobs?
If I may, Suzanne, I think one really important thing to do is for the person to talk to people who preceded them in the same university and to try to find out from other recent graduates or students who've had the kind of internships or work study opportunities that they're seeking. Because it's very, very common, and this was always the case for me when I taught at the George Washington University, that if Kay, for example, had a couple of my students as interns, that she would call me as they finished their internship and say, Richard, I can't tell you how much I love Lisa and Gus. They're just the two finest interns I've ever seen. Please send me 2 more students just like them. So I think that's something that many students don't do enough of. Talk to as many students as you can, see if you can find what other fellow students or recent graduates have done, and see whether or not there are particular places that really like students from your institution who might give you an opportunity that you might not get, for example, in a bigger place or in a place where they don't know your institution so well.
That's a great suggestion. And with that, I mean, we are over time, so I just want to be cognizant of that. And I want to thank all of our presenters today for participating, and thank you all for coming. I personally want to say thank you to Gus Birkhead, Kay Perrin, Lisa Sullivan, and Richard Skolnik for sharing their time, their expertise with us, and their thoughtful insights on their area. For webinar questions and feedback, please don't hesitate to reach out to me. I'm Suzanne Walker. For product questions, you can go to our website or you can go to jblearning.com/contact. The webinar recording, as I mentioned earlier, will be posted up on our YouTube channel. And if you would, we would love your feedback on today's webinar. I know we had a couple of small glitches, but hopefully everyone could hear fine, and we did enjoy this really informative presentation. With that, I want to thank you again for joining us, thank our presenters, and wish you a great day. This ends today's webinar. Thanks for joining.